Today, I've got a question for you. What month is Breast Cancer Awareness Month? Now, I get that might seem like a silly question since I think pretty much everyone out there knew the answer instantly. October. It's just around the corner. You know, the month of pink ribbons, pink jerseys, pink products everywhere you look. But now, let me ask you another question. Probably going to be a harder one. What month is Prostate Cancer Awareness Month? I'm going to give you a couple seconds. Well, if you didn't know, and I'm betting most of you don't, it's right now as I'm making and posting this video. Yeah, the answer is September. And don't feel bad if you didn't know that, because as I'm filming this, we're about 2 weeks into the month, and I haven't seen a single bit of coverage about it anywhere. Not in the news, not in the media, not on social media. Nowhere. And I've been looking for it. The fact that you don't know it isn't a knock on you. It's just simply proof that no one cares enough about men to talk about it or to highlight it. And in case you're wondering, the ribbon for Prostate Cancer Awareness Month is light blue. And sadly, that lack of awareness is costing lives, costing men's lives. And in this video, I'm going to talk about prostate cancer, how it affects men, and why it is so important that we raise awareness on the issue. Hey everybody, my name is Dan and welcome back to Men Need to Be Heard, the channel where we talk about the things no one else wants to touch, especially when it comes to the issues that men and boys face in today's society. And the reason I started out with the question is simple. We need to be talking about prostate cancer far more than we already do. We need to be raising awareness. The risks between breast cancer and prostate cancer are almost identical. For example, 1 in 8 women will face breast cancer in her lifetime, which I think anyone would agree is far too many. But here's the thing you probably don't know, which is that 1 in 8 men will face prostate cancer. Yeah, you heard that right. The numbers are just about equal, but it doesn't stop there. Each year, the mortality rate, aka deaths, are also close. About 35,000 men die from prostate cancer annually, compared to just over 40,000 women from breast cancer. And while you'll hear year-round, especially in October, how that's a tragedy for women, and let's be clear, it absolutely is, you won't hear nary a peep about the men. I mean, what more proof do you need that men aren't cared about and viewed as disposable? And again, let me reiterate this for everyone out there, because I know it's going to be brought up. Bringing this up isn't about taking anything away from breast cancer. That movement is a success story. It's something that should be applauded. It has saved countless lives and deserves every bit of recognition that it gets. But it begs the question, why aren't we showing the same concern, caring, and support for prostate cancer? Doesn't men and prostate cancer deserve the same urgency, the same visibility, the same resources as breast cancer does? The answer, at least right now and for the past several decades, as is proven by the lack of funding and awareness, is an emphatic no. And that needs to change. Here are the facts. In 2025, the American Cancer Society estimates more than 313,000 men in the United States will be diagnosed with prostate cancer. Of those, a bit more than 10%, about 35,000, will die. Sadly, that number is way too high and could be a lot lower if men got regularly screened. If prostate cancer is found early, the 5-year survival rate is nearly 100%. But if it's found late, after it spreads, the survival rate drops to about 37%, as is the case with pretty much every cancer out there. Early detection is often the difference between life and death. Yet, many men, maybe even most, don't get checked. And why is that? Well, I'm going to go into it a bit more down the road here in the video, but I think primarily it's because there's a lot of misconceptions and misinformation about the process of testing that causes men to avoid it. So let's talk about first what it's like to get checked, something that I do every single year. For most men, at least initially, it starts with a PSA blood test, usually when you get older. And if you're at a higher risk like I am, it becomes an annual thing. It's a simple blood draw, and I mean seriously. Even if you're afraid of needles, is that worse than having to deal with chemo, radiation, or whatever by not doing it? And for most men, once they do that, they'll just keep track of it periodically. If the number is high or rising, your doctor may repeat the test more often. They may order an MRI or even a biopsy, which is actually something I had done a couple of years back. And honestly, the worst part about it was that the operating room was freezing as they wheeled me in. On the other side, I got the best nap I've ever had in my life. Other times, doctors will do a quick rectal exam to feel for abnormalities. Yeah, you're right. They stick their finger up your ass, and they don't even buy you dinner first. No, look, that's not fun. It's not something any of us look forward to. But honestly, it's over in not even a minute, and I think the doctors hate doing it more than we hate having it done. That said, these days, the main tool is the blood test. And here's the good news. Not every diagnosis means rushing into surgery or radiation. Many men with low risk levels of the disease are safely monitored with active surveillance and careful observation, regular tests, and no real aggressive treatment unless the cancer changes. And let's talk about who is at higher risk. Well, first of all, men like me who are over 50, black men, men who also, like me, have a family history of prostate cancer, and men with certain genetic mutations like BRCA2. If that's you, the conversation about screening should happen earlier, possibly as early as your 20s or 30s. Guidelines vary, but at a minimum, the U.S. Preventative Services Task Force recommends that men between 55 and 69 make an individual decision about PSA screening after talking to their doctor. The American Urological Association suggests that high-risk men start the conversation no later than at 40 to 45. And as I've said, many of you are out there who might be higher risk like me, like who had a dad that possibly had prostate cancer. It might be even earlier that you need to get checked. Basically, though, in a nutshell, if you're 45 or older, it's time to have a conversation with your doctor. So let's get back to why men don't get checked, because that is the biggest thing that we need to address. More often than not, it's because of stigma, fear, or simply not knowing, which I covered earlier. Some men avoid the doctor altogether. Others worry about the side effects of treatment, or the, let's call it, anal skewering. But medicine has changed. Detection and treatment today are more precise, more personalized, and far less invasive than they were even 20 years ago. The real danger isn't the test. Oh no, my friends. The real danger is waiting too long to have the test. And this is where awareness comes in. This is why making sure people know September is Prostate Cancer Awareness Month is so important. Because you see, every October, breast cancer campaigns light up stadiums, dominate the news, and flood social media. The impact is massive. More women get screened, more funding gets raised, more research gets done, all of which is fantastic. But September, well, prostate cancer barely gets a whisper. In fact, I haven't seen even that this month. And that awareness gap leads to fewer screenings, less funding, and ultimately more men dying who didn't have to. As they say, follow the money and you'll find the priority. And there is no doubt the funding numbers tell that story. Federal cancer research dollars consistently give breast cancer more than twice as much support than they do prostate cancer. And it hasn't been for just 1 year, it's year after year, and been that way for decades now. Again, this isn't about competition, or more precisely, it shouldn't be. Yet, it actually is. The argument often made is that breast cancer should be the priority, but what they never say is why. Again, the statistics show rates of cancer and the mortality thereof are consistently equal, yet funding isn't. And let it be said, we aren't arguing for a single cent to be taken away from breast cancer research or awareness. We're simply asking for equality, asking that the dollars that are given are the same for both. Breast cancer advocacy is and has been a tremendous model for success. All I'm saying is simple. We need to match it for men. Men's health deserves the same level of commitment and not 1 minute, penny, or bit of effort less. So here's the takeaway. If you're a man 45 or older, or younger if you're in one of the higher risk groups I talked about, talk to your doctor about getting a PSA test. And since I know the algos aren't going to like this video, do me a favor and share this message with someone you care about. Because chances are he doesn't even know what's going on and you could literally save his life. Scream it loud and scream it proud. September is Prostate Cancer Awareness Month. All right, as always, if you got value from this conversation, hit like, drop a comment, and as I just said, share it with someone who needs to hear it. It does help the channel grow, which in turn raises awareness of the various issues that men and boys face and hopefully sparks real conversations and policy changes that we need to address them. Only takes a minute of your time and not a single cent out of your pocket. And yes, it could quite literally help change the world or save someone's life. All right, till next time, stay strong, take care of yourself, and never stop speaking up because men need to be heard.